been nearly 3 weeks since a liquid gas tanker exploded on the East Rand on Christmas Eve. The vehicle, of course, exploded, as you know, after getting stuck under a railway bridge near Tambo Memorial Hospital. This was the phone call to the Boksburg Fire Department on that day.
Hello.
Good morning. Is this Boksburg Fire Department?
Boksburg Fire.
Sorry?
You're looking for?
Boksburg Fire Department.
Okay.
I've got a truck that's stuck on Railway Street under the bridge, and the gas is leaking.
There's no one there.
Our driver is there. So he's on Railway Street and Hospital Road.
So what do you want us to do? You want us to tow it or what?
Yes, we're going to have to get the fire department to go out because it's gas leaking into the air. The truck hit the bridge, the trailer, and the gas is leaking out at the moment.
Okay, just hang on a minute. And you say that it's where is it?
Railway Street and Hospital Road.
All right.
There's a bridge there, the train bridge is stuck under the bridge.
All right. No, we will send out people to go and have a look.
All right, thank you very much.
As you heard in that phone call, the operator doesn't identify himself or the organization on whose behalf he answers that phone call. Critically, we now know the police arrived after the explosion, and that sound, of course, courtesy of Carte Blanche. They played it on the show this past Sunday, and I thought it was something worth hearing. What that means, of course, is that, as we now know, the death toll has gone up to 41. 12 healthcare workers were among those who died. Kuena Sikoba, Matlaka Mtlakaza, Mushimane Mahoa, Machachi Maila, Bore Machatladi, Nompumelelo Shezi, Kensani Tobela, Ntabiseng Mudisakeng, Simphiwe Kuhle Mbatha, Thokozile, Xaba Sibongile, Hobiane. The South African Medical Association has been supporting the healthcare professionals in the aftermath of that explosion, including, of course, the surrounding hospitals, and they've basically tried to help alleviate the crisis at Tambo Memorial, including providing counseling to those who were affected. Dr. Mvuyisi Mzukwa is the chairperson of SAMA and joins us now on the line. Thank you so much for your time. I mean, for all the medical training people like you have, nothing prepares you for a disaster like this.
Good morning to you, Bongani, and to your listeners, and thanks for having us in your program this morning. Yes, you are quite right. Incidents like those are really come at the time, one, when there's a crisis of shortages of medical personnel in the health care system, but also it came at a time when it was, around the festive season, where usually there's a peak in terms of the incidents that are motor vehicle accidents and stuff. So it came at a very wrong time, if I may put it. So I'm not sure if there's any right time, but it was just the time was very inconvenient.
I mean, and obviously because of the holiday season, I would imagine some medical personnel may not even have been around, as would normally be the case during, other times of the year. One of the things you've identified is the need for trauma support and counseling, not only for the healthcare workers, but indeed for the affected communities.
Now, that's correct, Bongani. What we did, as the South African Medical Association, in consultation, obviously, with the Tambo Memorial Management, we then, identified the need to support, healthcare workers, trauma support and counseling. And that process has already started on the 17th of this month. And obviously, we had to obviously have, those assessments there, and there was a need, obviously, to continue supporting those professionals and the rest of the staff. Because the problem is not only doctors and nurses it's the whole workforce in the hospital that needs support. Yes, and on top of that, we've done with the day shift, though not complete, but there's a need also to identify or to assist the night shift as well, which is I think it should be starting in time soon.
I remember warnings around the visuals that were circulating on social media, people being warned that the images were just difficult to look at, and people being cautioned not to share them. The people who would have been at the coalface of all of this, the healthcare professionals, the affected patients, their families, they couldn't look away, could they?
Sure. Yeah, and that's so true. I mean, you recall that also families, these people are coming from families. So if families see those visuals like that, and I think it was really, to a certain extent, very insensitive for communities to be sharing those visuals.
No, Chair. Let me just interrupt you there. I don't mean just the visuals. I'm talking about in the hospital itself. When patients were coming in needing assistance, the people who had to deal with all of that, they didn't have the option to look away.
Yes, that's very true. That's very true. We had not really. Healthcare workers had no option. They had to attend to patients. That's why we had to call other doctors, our members, to go assist there, because we realized that the work is overwhelming to those that are there. Because as you said in your introduction, some of our healthcare workers had gone for vacations and stuff like that. So there was a shortage at that time.
Yeah. I'm going to ask you to hold for a second, and I'm inviting now Londe Gasishi, who is the senior manager at Cloud Therapists, and they've been on the ground doing some counseling work there at that hospital, including, of course, affected community members. Londega, thank you so much for your time this morning. Just maybe, if you can, give us a sense of what you are encountering from the people you've been trying to assist in terms of the trauma that they're dealing with. I imagine some of them are still shell-shocked.
Good morning, Bongani, and good morning to the listeners. Thank you again so much for having us this morning. The situation on the ground, I must say, has been extremely, extremely somber. It's one thing when you hear it and you see from afar, but actually getting into the environment where you still see even some residuals, and you can actually see some of the damage. And these healthcare workers have been reporting for duty ever since in the same place. So some of them will have been, just saying that sometimes they will hear, sounds from the explosion, and some of them still feel very unsafe in the environment. And also, they still see some, because some of them were present on the day, and they still see, where the damage happened and where they may have lost some of their colleagues, and it's been really, really just, for lack of a better word, very somber. But we're, like I said, we're trying our best. We've got like a team of therapists on the ground, and they are continuously doing counseling throughout the day. Yeah.
Tell me about the importance of counseling in a situation like this, because obviously we much more readily pay attention to physical wounds, physical trauma that we can see. But for people who've been affected by this, I read the 12 names of the healthcare workers who died, who've lost colleagues, who've lost loved ones. The psychological scars they also need healing.
Yes, absolutely. I mean, like I said initially, you must remember that these people are still reporting for duty in the very same place where this traumatic incident happened. So above and beyond there being memories of what happened, they are being in a space where they're physically being reminded every day of the loss that they incurred, of the damage that they got to witness, of the lives that they saw being lost in the, and them feeling helpless. And still going back to the same place again, where they now are not seeing, colleagues, friends that they would ordinarily work with on a daily basis. So it's trauma that in this situation was ongoing from the time it happened, and every day after that, when you are in a high pressure environment where you're dealing still with saving people's lives and dealing with other people in that high pressure environment with all that trauma. So it's really, really important to take care of those people's mental health, and that's why we had mandated ourselves, and we said our primary concern would start within the hospital with the healthcare workers and spread out into the community.
All right, Londega, still more work there for you guys to do. Let me bring back Dr. Mzugwa now. As SAMA, you've tried to fund some of this counseling, but obviously you can only do so much. I'd imagine you would like to invite partners to come on board and help fund this critical work as Londega has just outlined.
No, thank you so much for that. Definitely. I mean, we are very grateful to MedScheme and GEMS for their generosity in terms of, the support that they've provided, financial support. But also, like you said, we are inviting, everyone who is capable, the private sector to come on board and assist, with this counseling initiative that has been started.
All right. And how do people get in touch? Do they just approach SAMA directly to be able to try and assist if they can provide funds or whatever assistance may be needed to help with this ongoing work?
Yes, they can contact SAMA directly so that those fundings are directed accordingly.
All right. Appreciate your time, Dr. Mvuyisi Mzugwa. He's the chairperson of the South African Medical Association. We also spoke to Londega Sishi, who's a senior manager at Cloud Therapist. So they're doing the hard work, the heavy lifting of doing the counseling. But the South African Medical Association needs more funds to be able to help these healthcare workers, community members. And the tragedy of the story, and you can watch the piece on Carte Blanche. You can catch it on Catch Up, I think. One of the things that they showed there was almost the tragedy of errors in terms of responding to this crisis. I played you a little bit of the phone call where the operator doesn't even identify himself, much less know or realize the urgency of the situation, and getting, say, for example, police officers on the scene just to keep the crowds away. How typically South African that story is, isn't it?
Current events, developing stories,
tough questions.
Your voice making a difference.
This is Breakfast with Bongani Bingwa.